Here, we're going to go to peripheral nervous system. You have 12 pairs of cranial nerves. These are part of peripheral nervous system, and 31 pairs of spinal nerves. Cranial nerves in function, they are either sensory or afferent. What does that mean? That means they carry impulses towards central nervous system, or they're motor in function or afferent. They carry impulses away from central nervous system, or they are mixed, basically more both sensory and motor. They are in one nerve bundles. These cranial nerves, they are located inferiorly. When you look at the brain, you have to go inferior of the brain, and they are numbered in order anterior to posterior. Spinal nerves, there are 31 pairs of them. They're all mixed in function, so they have the bundles of both sensory nerve in one nerve bundle. They are numbered based on the area, name and numbered based on the area they are associated with that vertebrae. For example, cervical, thoracic, lumbar, sacral. Here we're looking at inferior view of the brain. This is the anterior end of the brain. This is the posterior end of the brain. This part of the brain in white is called cerebrum. This in pink is called cerebellum. And this is the spinal cord in white right here. Now I'm concentrating on the cranial nerves in dark pink. These are olfactory nerves, one, and you have them in pairs on both sides. Olfactory nerve 1, optic nerve 2, oculomotor nerve 3, trochlear nerve 4, trigeminal nerve 5, abducens nerve 6, facial nerve 7, auditory nerve 8, glossopharyngeal nerve 9, and then we go to vagus nerve 10, spinal accessory nerve 11, and then we're going to kind of come back to the top. We have hypoglossal nerve 12, these two, hypoglossal nerve 12. So they're in pairs on both right side and left side. This is a mnemonic device for you to learn the cranial nerves. You have olfactory nerve 1, optic nerve 2, oculomotor nerve 3, trochlear nerve 4, trigeminal nerve 5, abducens nerve 6, facial nerve 7, auditory nerve 8, glossopharyngeal nerve 9, vagus nerve 10, spinal accessory nerve 11, and hypoglossal nerve 12. So we're calling it, the mnemonic device is on old Olympus's towering top, a fin and German viewed some hops. On old Olympus's towering top, a fin and German viewed some hops. That's how you remember the orders of them, at least. And then as far as the functions of these cranial nerves goes, you call it sensory, sensory, motor, motor, both sensory and motor, motor, both sensory and motor, sensory, both sensory and motor, both sensory and motor, motor and motor. Some say marry money, but my brother says big brains matter more. Here we're looking at the spinal nerves. They are, as far as their function goes, they are mixed. So they are both sensory and motor in function. You have 8 pairs of cervical nerves. They are called cervical spinal nerves C1 to C8, T1 to T12 for thoracic nerves, L1 to L5 for lumbar, S1 to S5 to sacral, coccygeal, you have C0, 1 pair. So you have cervical nerves, thoracic nerves, lumbar, sacral, and coccygeal. Here we're looking at plexes. Plexes are these collection of, they're kind of like braiding, collection of nerve that they innervate a specific region of the body. For example, you have cervical plexes. They innervate head, neck, and diaphragm. Brachial plexes, they innervate the upper limb. Lumbar innervates the anterior thigh, and sacral innervates buttocks, lower limb, and pelvis. So it's marked for you here. Cervical plexes is C1 to C4, C1 to C4, so part of the cervical nerves. You have brachial plexes, C5 to T1. You have lumbar plexes, which is L1 to L4, and sacral plexes, which is L4 to S4. These are kind of like braided, as you can see, they're kind of like intertangled.